The drainage bag for an indwelling catheter should always be placed A. Below the level of the bladder. B. On the same level as the bladder. C. Above the level of the bladder. D. On the patient's lap. Answer A. Below the level of the bladder. You notice that your oxygen-dependent client has an overflowing ashtray next to her bed. You should A. Scold her for smoking with oxygen. B. Report the finding to your supervisor at once. C. Call Adult Protective Services. D. Take away the cigarettes. Answer B. Report the finding to your supervisor at once. Universal precautions require you to treat which of the following as if it were infected with blood-borne pathogens? A. Food. B. Clothing. C. Blood. D. All of the above. Answer C. Blood. The most widely used form of personal protective equipment is A. The mask. B. Gloves. C. The gown. D. Goggles. Answer B. Gloves. A home health aide spends about 20% of his time driving to and from client homes. Auto safety measures include A. Wearing a seatbelt at all times while driving. B. Always following the posted speed laws. C. Allowing enough time for your drive so you don't have to hurry. D. All of the above. Answer D. All of the above. The standards for universal precautions you must follow are based on guidelines established by A. ORIF. B. OBRA. C. OSHA. D. HCFA. Answer C. OSHA. Clients may be able to dress themselves with assistive devices such as A. Hooks and eyes. B. Small buttons. C. Zipper pulls. D. All of the above. Answer C. Zipper pulls. When preparing meals for your client, you should A. Cook whatever food the client likes. B. Bring foods from home to save time. C. Follow principles of cleanliness in the kitchen. D. Prepare foods you like the best. Answer C. Follow principles of cleanliness in the kitchen. A client on a low-salt diet would have restrictions on all of the following food items except A. Milk and cheese products. B. Processed meats. C. Canned vegetables. D. Fresh fruits. Answer D. Fresh fruits. The home health aide should not wear strong perfume because it might A. Have strong negative memories for the client. B. Make the client sick with nausea. C. Annoy the client. D. None of the above. Answer B. Make the client sick with nausea. Healing of a fracture requires extra nutrition, as found in a diet that is high in A. Sodium. B. Fiber. C. Calcium. D. Protein. Answer C. Calcium. When caring for a client with heart disease, you should observe and report any symptoms of A. Pain. B. Changes in skin color. C. Changes in vital signs. D. All of the above. Answer D. All of the above. You might expect a client with COPD to have a medical order for A. Decreased fluids. B. Respiratory mask on at all times. C. Increased fluids. D. None of the above. Answer C. Increased fluids. Your client has right-sided CV-related vision impairment. This means that the client cannot see out of his A. Left eye. B. Left side of either eye. C. Right eye. D. Right side of either eye. Answer B. Left side of either eye. Which of the following symptoms is not associated with the aging process? A. Decreased muscle size. B. Stiff and swollen joints. C. Increased stamina. D. Brittle bones. Answer, C. Increased stamina. The following are all symptoms of a stroke except A. Pain upon urination. B. Dizziness. C. Paralysis of one half of the body. D. Difficulty speaking. Answer, A. Pain upon urination. The hormone insulin is produced by the A. Adrenal gland. B. Pituitary gland. C. Pancreas. D. Gallbladder. Answer, C. Pancreas. During which of the following stages of dying would a terminal client be most likely to say, "The doctor must be wrong"? A. Denial. B. Anger. C. Bargaining. D. Acceptance. Answer, A. Denial. The last sense that remains present in a dying client is A. Taste. B. Smell. C. Hearing. D. Touch. Answer, C. Hearing. Proper hand washing requires you wash with friction for a total of seconds. A. 5 to 10. B. 10 to 15. C. 15 to 30. D. 60. Answer, D. 60. A client with chronic respiratory illness will probably be most comfortable in which position? A. High Fowlers. B. Trendelenburg. C. Prone. D. Supine. Answer, A. High Fowlers. Proper use of a transfer belt is critical to safety when you are A. Bathing a client. B. Performing range of motion. C. Ambulating a client. D. Positioning a client. Answer, C. Ambulating a client. A client undergoing chemotherapy may need mouth care done with A. Waxed floss. B. Soft toothbrush. C. Toothets. D. None of the above. Answer, C. Toothets. When caring for a client with arteriosclerosis, it is particularly important to remember that A. Hot water bottles can cause severe burns. B. Circulation is still adequate. C. Injuries usually will heal well. D. The client can expect a cure eventually. Answer, A. Hot water bottles can cause severe burns. The organs of the urinary system include the A. Stomach, esophagus, small intestine, liver. B. Kidneys, ureters, bladder, urethra. C. Heart, lungs, blood vessels. D. Ovaries, testes, uterus, vas deferens. Answer, B. Kidneys, ureters, bladder, urethra. A bed cradle is used primarily A. As a cooling device. B. So the linens can be changed more easily. C. To prevent pressure from the top linens. D. For warmth. Answer, C. To prevent pressure from the top linens. When a client offers you a tip for your services, you should A. Accept it as a common perk of home care. B. Refuse it and act shocked that it was even offered. C. Accept it but give it to your employing agency. D. Refuse it in a firm and courteous manner. Answer, D. Refuse it in a firm and courteous manner. When a client is receiving oxygen, you should always remember that A. Oxygen must be moisturized. B. Oxygen feeds a fire, so fire prevention measures must be used. C. Even in a home there should be an oxygen use sign. D. All of the above. Answer, D. All of the above. In passive range of motion, abduction means A. Bringing a limb toward the midline. B. Bringing a limb away from the midline. C. Increasing the angle between two bones. D. Bending a limb at the midpoint. Answer, B. Bringing a limb away from the midline. The blood vessels that carry blood away from the heart are the A. Arteries. B. Veins. C. Venules. D. Capillaries. Answer A. Arteries.